Hi guys, my name is Devin and this is my structured video response number one. For question number one new piece of knowledge that I learned about the DNP-FNP role was that even though the DNP degree was made to prepare professionals as advanced practice providers, a lot of chief nursing officers or CNOs aren't well versed in the clinical outcomes of DNPs. I feel like we need to do more research and educate the public and these CNOs on what DNPs can bring to the table and how they can best increase patient care and patient safety. A lot of these early studies suggested that CNOs would definitely hire DNPs, but some modern day studies are still kind of up in the air. One study showed that 41% of the polled CNOs stated they hired DNPs, and the majority of these CNOs said they were somewhat likely to hire more based on their current knowledge of the DNP scope of practice. So basically this boils down to a lot of the hospital administration not knowing exactly what DNPs can bring to the table. So for question number two, the DNP with FNP certification enhances my future as a healthcare leader in a couple of ways. One of them is by giving me the knowledge to apply evidence-based practice in my patient interactions to best provide patient care. I'll be seeing unique patient populations and patients that might need interdisciplinary collaboration, and my DNP-FNP training will allow me to use this training and education to give individualized care based on each patient's unique presentation. We all know patients aren't the same, they don't fit the cookie cutter model. Some patients might need more outpatient like PT or OT care versus like speech therapy versus some sort of like consult like cardiology or urology. So I feel like this training will help me kind of decide where to direct my patients. So question number three, the DNP essential that resonates with me the most is clinical prevention and population health for improving the nation's health. So I work as an ER nurse in our one of our state's largest ERs, and a lot of patients come in for primary care related reasons like high blood pressure, and they've never seen a PCP, never been diagnosed with hypertension, they're not on medications, and they expect our ER providers to kind of assess them, diagnose them as primary care providers, and prescribe them high blood pressure medication, even though this is more of a primary care related visit. So this is very important to me, and I feel like as a DNP FNP I can help increase the quality and the availability of primary care to these patients and kind of decrease or offload the stress and the misuse of ERs, leaving those ERs available to take care of more critical patients that don't need primary care visits. So for question number four, the competency that resonates with me the most is the scientific foundation competency. So this competency integrates knowledge from the humanities and all the sciences and kind of combines that within the nursing context to provide best patient care. So not only do you take all the scientific knowledge from all of your nursing courses, pathophysiology, pharmacology, but also all the knowledge from the humanities like culture and socioeconomic factors and stuff like that. We all know we live in a culturally, socio-politically diverse society. Just in Utah, you can just see if you go to the ER or if you go to even like the mall or even your primary care doctor, there are so many different patients with different ethnic backgrounds, religious backgrounds, socioeconomic backgrounds. And I feel like a DNP FNP education will help kind of bring awareness to all of those to best cater towards your individual patients. And I think it's important to educate yourself on the difference of these cultures, these religions, these ethnic backgrounds, to be, sensitive to your patient needs and not judge them. I wouldn't say judge them, but, mistailor your care, if that makes sense. So question number 5, something unique about myself. I don't know if this is super unique, but I love to travel. I've been to many different parts of the world. I most recently traveled to Iceland last year. It was me and 2 of my very close friends. We rented this really tiny podunk, rundown, 2-person minivan, and we did the whole ring road, which is the main highway around the entire country, in about 2 weeks. So that was pretty fun. It was a little dangerous. Sometimes I thought I wouldn't get myself home, but we managed. Eventually, when I graduate, I would love to visit the Peru or Chile or Argentina areas, just depending on where I get a job and my life circumstances. So that's about me.